Hi there, my name is Asia Miles, and I'm going to be speaking on the health belief model in regards to routine checkups in women in the United States. So, the contents of this presentation is going to include a brief introduction, the health belief model, barriers to routine checkups in women in the US, the impact of neglecting their health, perceived susceptibility and that intervention, perceived barriers and that intervention, the perceived benefits in that intervention, leveraging social media and potential outcomes, and the conclusion. So, many women in the US neglect regular checkups for a variety of reasons, including childcare, transportation, finances, lack of awareness, and stigma around accessing healthcare. Early detection of conditions like cervical cancer and polycystic ovarian syndrome are very common and regular and can be accessed very readily within society today, but we still see women not seeking these health sources out. So, the health belief model. What is it exactly? So, in the book that we had for this course, Introduction to Health Promotion, it explained that the health belief model was developed in the 1950s to kind of break down why people don't go about getting preventative disease treatments and trying to just dig down into why people kind of are resistant to that. The 6 constructs of the health belief model include perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to action, and self efficacy. So, out of these 3, I'm going to be talking about perceived susceptibility, perceived benefits, and barriers in this presentation today as it pertains to women's health in the US today. So, barriers to routine checkups in women can include childcare responsibilities, transportation challenges, financial constraints, and, like I mentioned before, stigma around seeking healthcare. So, in terms of childcare responsibilities, the NIH did report that among women who delayed or miscarried, 54.5 cited that childcare barriers were the primary reason. As it pertains to transportation challenges, the NIH also reported that um, that transportation barriers were 33% of the reason why women were not seeking out routine checkups. For financial constraints, there was a survey done by Deloitte, where women were 31% more likely to forego routine checkups compared to men due to the cost. And this is something that is very common and regular. People don't go to the doctors because of insurance issues and having to pay co-pays out of pocket and things of that nature. And lastly, stigma around seeking healthcare. There was an article published by the New York Times that examined the tendency of healthcare professionals to kind of dismiss or underestimate women's medical symptoms, which often attributes to the exacerbation of health issues because women will just ignore them after the person they're seeking out for this help kind of dismisses them. The impact of neglecting health includes missing opportunities for early detection of diseases, like I mentioned before, cervical cancer and polycystic ovarian syndrome being the top 2. Worsening conditions. This can also lead to reproductive health, a mental health decline, and seeking out these routine checkups will help in early detection and improve survival chances. So, if you don't go about these services, you have prolonged polycystic ovarian syndrome, prolonging different cancers, and things of that nature. So, early detection does provide a significant chance of survival. So, perceived susceptibility. So, for this intervention, I had wrote about in my essay as well, developing a personalized risk assessment, which will help to identify potential health risk for not undergoing these regular checkups. And using social media was the main avenue I had based the assessment around. You have different ads on social media such as Instagram, Facebook, Snapchat, and YouTube and the like, and you kind of click on an ad and it takes you to a website. So that was the thinking behind making sure these assessments are accessible to people online through social media. These assessments are going to be based on age, lifestyle. So this is if you work, if you're sedentary, things of that nature, and different pre-existing conditions that you could have, such as polycystic ovarian syndrome, and things that are more normalized, such as high blood pressure, arthritis, different things like that. And the goal of this intervention is to increase awareness for different things that you can be at risk of in terms of health, and kind of light the fire to go to the doctor and go seek out these regular checkups. For perceived barriers, my intervention was to offer free or discounted exams through different community partnerships, through different hospitals and clinics such as Kaiser, and just different urgent cares, things of that nature around the town. So this is going to reduce cost barriers by giving women in particular vouchers or free exams or free screenings for things like breast cancer who cannot afford it. These vouchers would also cover additional care for people who, let's say, screen positive for cancer or something that they're just going to need treatment afterward for. The vouchers that they would receive would also go to help these issues, to not leave them kind of, I tested positive and I do have breast cancer, but I don't know where to go about treatment. So we would not leave women, alone in that. And the goal is to reduce financial obstacles and improve access to care. Lastly, for perceived benefits, my intervention is to create personalized health improvement plans with designated healthcare providers. So this is doctors, different physicians, nurses within the healthcare field that can work with these individuals and women and kind of match them together to create personalized wellness plans. These wellness plans would address specific health risk physically and also mentally, and these wellness plans are going to focus on women's health and how to keep them healthy in the long and grand scheme of things. So the goal of this is to emphasize positive outcomes and highlight this preventative health measure. So leveraging social media and potential outcomes, I chose to go about catering this on social media in particular because it reaches a big amount of people in a small amount of time, and it's very important that women in particular take part in early detection treatments, and just getting screened regularly for things and making sure their health is their wealth, and that's of extreme importance. So in conclusion, this presentation was to address barriers to routine checkups for women. The health behavior model helps to provide an effective framework and interventions, and I wanted to bring awareness and possible accessibility through personalized plans that can activate change within women in the society. Thank you so much for listening, and have a good night.